file a formal memorandum or letter to the Senate, and this committee will grant them an audience. And if this committee needs to call the governor to respond to the issues they have raised, this committee will do so. So I want to encourage, be they the contractors, be they the circles and institutions, some of whom have sent petitions to me saying that statutory deductions have not been remitted. We are not rubbishing those allegations, but we are just asking we do it in a formal manner and a structured manner so that the governor and the county executive has an opportunity also to respond to the issues. So today we will deal with the report of the Auditor General. The other related issues, if we can't process them here, we can still set another date for a broader conversation with the other stakeholders. In the earlier deliberation in the morning, we have also taken the position that we are more effective when we come to counties. And so in the month of October, or perhaps towards the end of October or early November, we intend to do a county visit to the Western Circuit, where we'll be visiting Nyamira County, we will visit Homa Bay County, and a few other neighboring counties, because some of the issues in this report require physical verification. So you can't discuss Kigoto in Nairobi. You cannot discuss water pan in Karachuonyo in Nairobi. So we will still have that opportunity to come to Homa Bay and engage those various stakeholders. So I just wanted to make that clear and to assure those who had expectations that we'll be discussing in detail issues to do with contractors, that if we do it properly and formally, then the Senate would be seized of the matter, and we will even come to Homa Bay to have that conversation. So with that, we can go to the report of the Auditor General, but I want to ask the County Assembly, first of all, whether they have processed these reports and if there are any recommendations that you may wish to share with the Senate. Chairman, Public Accounts Committee.
Thank you, Honorable Chair. I want to confirm to this Honorable Committee that we've processed this particular report. We've engaged with the executive for the purpose of this, and our recommendations were forwarded to the executive for actualization. And I believe, because I've also seen the report they've presented before you this morning, all that we actually indicated to them for the implementation has already been undertaken. And I believe they are captured before you. You will be able also to look at them and advise accordingly based on what we prosecuted within the Assembly. I thank you.
Honorable Chair, are you able to share with us your report, the report that you're referring to?
That was actually forwarded to your secretariat through the clerk's office.
Clerk?
Chair, no, we have not received it.
Auditor General, have you been involved in that exercise that the Chair is referring to?
Chair, we confirm that we have not been involved in that exercise. If there are committee meetings, ideally, they're supposed even to fight the Auditor General in that process. But as far as I'm concerned, I'm not aware about that meeting where they prosecuted this report.
Chair, would you like to reframe your response, because it's a very specific one? We are dealing with the reports for 2023-2024 financial year.
Yes.
Yeah, so maybe you might just want to think through it and let us know if indeed your committee has called members of the executive in a meeting where the Auditor General is present, and you have generated recommendations that have been tabled in the Assembly, adopted, and forwarded to the executive for implementation. That is a process for 2023-2024, leave alone the other years.
Honorable Chair, I'm clear in my mind that this particular financial year in question has been processed by the Assembly, and if you give me some few minutes, it will be wired in soft to the Senate Secretariat so that you will be able to see. And I also want to bring to your attention, I really like when the Auditor General disputes we always do a letter to the office, and you see this cannot stop us from proceeding if it is their obligation to send their officer to come and attend our meeting. But this one in particular, we've prosecuted, we've called the executive, and that is why I'm here. In a few moments, you will get to see the report before a conclusion of this meeting. But whether to confirm the position of the Auditor General, I believe if you want to engage me on that, I'm here. Thank you.
I think my colleagues have could be having views on this, but I don't want us to debate it because the chair said he's going to furnish us with a report. Please get us a report, and parliaments operate in the same way. A report that indicates the date on which it was tabled,
Yes.
the date on which it was adopted by the House,
Thank you.
and it would be helpful also the forwarding letter from the clerk of the assembly to the executive.
Thank you.
But any process of that nature that does not involve the Auditor General is null and void. Senator Wanga.
Chair, very interesting. The chair says he likes it when the auditor disputes. Why do you like it?
Thank you, Honorable Chair. Maybe through you, Chair, can I respond to that? Honorable Chair, I don't know what the standing order states, and you see, when the clerk's office writes to the office of the Auditor General, I don't know whether it is incumbent upon us to force them to attend to our meeting, but you see, what the standing order clearly states is that when we write to them, they are supposed to avail themselves and come and attend.
Chair, let me stop you there.
Yes.
So that we have this conversation once we have seen the report.
Thank you.
And please, you as a member, you know some of the implications of making statements that are not factual before a committee of parliament. And I am not putting any doubts, because you have promised you are going to table the report. It will be very useful. You can quickly tell your clerk to forward it to us, because we don't supervise you as a county assembly.
Yes.
You are the primary overseers. And when we find that an assembly has done a proper job, our work here at the Senate is very simple. We just take your recommendations and ask the governor, why haven't you implemented the recommendations of the county assembly?
Thank you.
So please get that document quickly. Once we get it, we shall just look at your report and life is going to be easy. I think, members, we can advise the assembly once that report has been tabled. I know we have a lot of views, but we can do it at that point. But let's remember that that report is a report authored by the Auditor General. And so if you're going to consider it, the Auditor General needs to be present. The Auditor General is a prosecutor. It's their case. It is their report. So I'll be very happy to see that report. I'll be very proud to tell my colleagues at Homa Bay County Assembly is ahead of the rest. So let's get back to the governor and deal with the reports of the Auditor General. There are three reports. There was a County Revenue Fund, the Receiver of Revenue, and the County Executive. We would have started by making some observations on the CRF report, but we shall deal with it once we get the report from the Assembly, because one of the issues that was raised in the CRF report was on the allocations to the County Assembly, and OAG can deal with that once the Honourable Member shares with us the report they have done. We'll therefore start with the Receiver of Revenue report. It's a fairly small one. We can dispense with it and then go to the Executive report. Auditor General, on the ROR, you raised several issues. The Senate made several recommendations. Overall, how many of the Senate recommendations have been implemented? Just give us a dashboard.
Yeah, thank you, Chair. There were 18 issues that have been raised. 3 issues has already been addressed, 3 partially addressed, and 2 issues not addressed.
You said there were 18 issues.
No, 8, sorry, 8 issues.
8 issues.
Yeah, sorry.
Yeah, so, Governor, because we didn't get to interact with you at the initial responses, where we took only the written responses, you would expect that senators might go back to the financial statements. I hope you have the financial statements. There could be some clarification that would be necessary from the financial statements. I think let's start by asking, who is the receiver of revenue in Homa Bay? Who is the designated receiver of revenue? Governor?
Thank you. This is Mr. Alphonse Wera, the Chief Officer Finance.
The Chief Officer Finance.
Yes.
Then just the presentation of the financial statements, I see two signatories to it. But one is just a signature without a name, without an ISPAC member number. Is this a legitimate certification on the financial statements? And I hope you have furnished the governor with the detailed financial statements. It's extremely important. It's like going to church without a Bible.
They're bringing it, Chairman. Yeah.
I think this is just an observation. I probably wouldn't make a big deal out of it, even though we have taken a view that if you're a professional and a member of a professional institute, you must comply with the standards within that space. Governor, have you observed the problem?
Yes, I've seen this, Chairman. And I think
so who's that second signatory? Where it's just a... You remember we were together in Okoa, Kenya. We were told that our signatures were not valid. So you've got something that looks like an elephant there, without a name, without an ISPAC member number. So if we want to refer someone to ISPAC, how do we make that referral?
Chairman, I think this should have been properly signed. The signature here, I am advised, is the head of accounts, who is a CPA and with a full ISPAC number. So he should have put his name and his signature on it. So if you have some referrals to make, what is the name, full name of this signatory? It's called Sifuna Okelo Sita. And ISPAC member number? He has to put
30278.
Be on record.
Thank you, Chair. 30278.
Are you in good standing with the Institute?
Yes, I do.
If you continue signing financial statements without those details, you will cease to be in good standing. I hope you know what I mean.
Noted, Chair.
Yeah, and you had introduced that your people have PhDs and they are professors. So some of us are now starting to believe otherwise. Because if they are not confident enough to display their standing and who they are, then it is not good.
Perhaps, Chair, what you should have done for neatness is to find out from him why then he uttered a document to the Senate in the manner that he did.
Right.
Because I mean, how do you explain that? He's here, he's giving us the number. How do you even know that he's the one making the governor knows?
Maybe that one can be confirmed by the Secretariat, the ISPAC number, whether he is active or is in good standing. There are two things that Chair needs to be confirmed, whether he is active and whether he is in good standing. And then number two, we need to invoke the Public Audit Act. When an officer like Sifuna Sita signs a very serious document that has financial statements that is not properly signed, then I think we should not recommend administrative action. I think this professional misconduct and should be written to the ISPAC for punishment. Because I can imagine this recklessness and dereliction of duty that has been done. So, Chair, unless Mr. Sifuna Sita will tell us something unique that will avert our thinking in terms of signing this documentation, then the Public Audit Act and the necessary ISPAC, he must be punished accordingly. And I think, Chair, you have made ruling where even clerical errors these matters have been referred to the ISPAC. So, Chair, I submit that as the Secretariat check on the ISPAC number of this gentleman, this matter must be taken up by ISPAC and, of course, cited for professional misconduct. I yield, Chair.
Could we just go through the report and find out whether there are any other professional malpractices beyond the signatory ones? Then we can consolidate our case to ISPAC. But I think that's an observation that if there was some keenness, the auditor ought to have raised it and it should have been arrested at the management letter level. We expect Homa Bay to do better because the stories of on-source revenue in Homa Bay, what we hear are stories of success. But let's look at the details. So, OAG, why don't we start by looking at the systems environment? I think the governance environment. Governor, I've had someone introduce themselves as a chair of a board. So maybe before we go to the systems, you could just let us know, the governance structure. So you have a receiver of revenue, you've got a board. How is that structured? And maybe we can pick a lesson or two from there, which you can share with the other governors.
Thank you, Chairman. And maybe I'd like to thank you and congratulate the committee for coming up to date, because I know it's not easy. I know the number of hours, having sat in PIC, it takes to just get to up to date 23-24. So congratulations, Chair, and we are proud that to be associated with you, Chair, as Homa Bay County. But coming to the question of the structure of how we do our revenue collection, so we have our receiver of revenue, who's the Chief Officer for Finance, and we also, in 2023, did pass a Homa Bay County Revenue Board Act, and we constituted a County Revenue Board chaired by Dr. Konyango, who's here with us, and they are the ones overall responsible for collection of revenue, the administration of revenue collection. It is a board of 7 members. There's 7. Yeah, it's a board of 7 members with us, a CEO of the board who is also the director of revenue in the county. So what they do is, apart from running, they're a part-time board, so they run revenue collection, and we convene every second Thursday of the month. The board convenes all of us, the entire, myself, my TCs, and the chief officers, to review the revenue collection. So in terms of structure, we have the Revenue Administration Act, we have the Revenue Board Act, and then we have the Finance Act. So that is the structure that we use for purposes of revenue collection, Chair. So the receiver of revenue is also a member of that board. It sits in that board.
In terms of forecasting on on-source revenue, is that done by the board or that is done by management?
This is done by the board in consultation with the management. So it is done by the management in consultation with the board.
Because one of the concerns that we had noted earlier is that you had a budget of 2.3 billion on-source revenue. Of course, it was revised along the way, and you achieved 1.2 billion. And the question that we've always had is that, do we overestimate on-source revenue so that we can balance some numbers, especially the fiscal responsibility numbers? What's the science of budgeting 2.3 and achieving 1.2? Yeah. What is that outlier event that you are anticipating that would grow your revenues by 2 billion in a year?
Chair, before the governor responds, perhaps she was anticipating some sort of pandemic in Homa Bay. Because if you look at the numbers here, out of the 1.2 billion realized from as on-source revenue, 841 million is from hospital charges. And that is very worrying to me, because I'm wondering, why do you need a board I thought that board is for revenue is supposed to come up with creative ways to raise revenue for the entity governor. Just sitting there at level 4 and waiting for people to come and pay hospital fees is not very creative. And the people of this country have heard stories about how healthcare is supposed to be free. What happens, Governor, when we achieve true universal healthcare? The entire revenue model for Homa Bay will collapse.
You may have noticed that the budget for hospital fees was 1.8 billion. I think that was the original budget, 1.8 billion. Yeah, so maybe, so what's a science around these numbers? Because there needs to be, if you're doing zero-based budget, you don't just wake up and plug in a number, put a number in the air. It must be aligned to certain factors.
Chair, maybe
Senator Chirarge, then the governor can answer.
I want to agree with Senator Sifuna because, and you know, we have passed Facilities Improvement Act, which now separates the revenue that goes to hospital. And I'm trying to look at the revenue streams of Homa Bay under receiver of revenue. Chair, apart from the revenue that are generated through the hospital, what is, maybe the fiscal analyst can tell us, Chair, what is the revenue potential of Homa Bay? That what is the revenue potential? Of course, as a county of endless potential, what is the revenue? Number two, Chair, these revenue streams looks like they have not been harnessed, and the projection that there has been consistency in trend analysis looks more cosmetic as opposed as to real on what is happening in terms of harmonizing. So, Governor, this board seems it, apart from just isolate the issue of revenue that is generated by the hospitals, give us what are the total revenue streams and this inconsistency between the financial years that Mr. Alphonse were as analyzed from financial year 2021, 2022, 2023, 2024, and I think up to 2023, 2024. So that would settle my mind. And maybe before Governor answers, Chair, with your indulgence, maybe the fiscal analyst, I don't know whether Salat is here, can give us,
Salat is here. You can give us
the revenue potential.
OSR potential.
OSR potential.
Homa Bay has really surpassed this revenue potential. The revenue potential for Homa Bay is 1 billion, 24 million, and 200,000. So they have really surpassed the.
Okay.
So that assessment by the CRA indicators. So maybe on the other part, on the issue of revenue streams, maybe the governor can tell us and whether all the collection of revenue has been digitized, and whether they own the domain and who runs, or do they pay the agency fees in terms of the running and collection of revenue, whether it is automated, Chair, so that but we really want to know other revenue streams, Chair. I yield.
Senator Katai.
Thank you, Chair. I want to end on the question posed by Senator Sifuna. One would be interested to know now that we have a board in place which is supposed to oversee the administration of the revenue and so forth. So away from the area of the sector, which is coming out very significantly, which is collecting around 841 million, we have some other streams like market dues with very true collection. We have beach fee services, very true collection. So what is the safety story about this board?
Okay.
If you delete, if you are not considering any of the sector, I mean, other streams are almost like there's nothing being corrected from those other streams.
Fine. The question, the last one by Senator Chirarge on systems, because it's a substantive audit issue, we can deal with it by referring to the audit report. But maybe just go back to the issues raised by the senators, and maybe we sound cynical because we are not used to success stories within the public finance space. The PBO is telling us that your revenue potential is 1 billion. You have exceeded it. I mean, it is a kind of, we should be congratulating you, but you need to prove to us those numbers. Your revenue potential is 1 billion, but you had a budget of 2.3 billion. That also brings to doubt the projections from the CRA, because if Homa Bay can project 2.3B and they are doing 1.2B, unless those projections exclude hospital fees, because there is a conversation around hospital fees, whether they should be here, and yet you've got facility improvement financing, which should segregate the numbers. But Governor, you may respond. We are happy to listen to a success story.
Thank you very much, Chairman, and I thank the senators for their questions. So Senator Sifuna said, if we remove the health sector revenues, will our revenue model collapse? So first, I'd like to state that when we came to Homa Bay in 2022-23, our revenue, inclusive of the health sector revenue, was 300. Was it 200? Yeah, it was 234 million, which means that.
Which financial year is that?
That was 2019-20 or 2021-22. 2021-22. So starting from that point, inclusive of the revenue generated from healthcare, we wanted to see how to consolidate our revenue. The revenue.
Accuracy, just on accuracy, Governor.
Yeah.
I thought the report has been done by Were. Why don't the Governor quote the exact figure, and it is here? This is on receiver of revenue 21-22. This is your receiver of revenue statements for financial year 20, but you have given analysis of 21-22.
How much?
311,995,474. 21-22.
Okay.
And then in 22-23 is 859,454,023. And now in 2023-2024 is 1.2 billion 495,830.
Thank you.
Yeah, but it demonstrates what you're saying.
So I think the point I was trying to make there is that inclusive of the healthcare revenue, the revenue was still performing very, very low. So one of the things we had to do within our facilities is to see also how do we consolidate the revenue, because this revenue goes back to provide healthcare to the people. So so in the first place, our revenue improvement plan had to include our health sector revenue, because we felt there was also something going on there that we could work together to improve. And that is why we moved it from the 311 and to 2022-2023. No, 2022-2023. It was 859. So Senator Sifuna, even working within what we have, even in terms of healthcare revenue, there has still been significant improvement, even in that sector alone. And that improvement reflects then on the level of service within the facilities. Then coming to the other revenue streams. If you look at land rates, for example, actual revenues in 2022-2023 was 5.9 million, and then actual revenues in 2023-24 was 8.3 million. That is for land rates as an example. If you look at single business permits, in 2022-2023, there were 61,770,000. If you look at 2023-2024, we moved from 61 million to 99 million. And in 2024-2025, we are at 101 million. So we have, because of the revenue administration measures, including the board, we have had improvement, not just in the health revenue, but in all our revenue streams, because of the order that has been created.
Governor, you might be looking at a different document, because mine is 64 million for 2022-2023 for single business permits.
Yeah, the report that I have here is 61 million. What you have is?
22-23,
Yeah.
64,744,620.
And 23-24?
101.
And this is the only.
We don't have the 90 that you're speaking
I
of.
think your team should
I'm
point
reading
you to
a
the statement
different
of receipts and disbursements under the receipt of revenue statement.
That report.
Because that's a report, that's the basis of the audit report. It bears the numbers that Senator Sifuna is.
And Governor, the reason why I am expressing concern personally, and you see the chair was prodding me to say my other title, I didn't want to say it. But now I have to say it, the SG of ODM, a party that has committed that when we take power, there will be free healthcare. And the people of Homa Bay will not be paying anything at level 4 hospitals. That will take away 70% of your revenue. That's the concern we are raising. Secondly, Governor, address these landing fees. If in my head I get it correctly, are these beach landing fees for fishermen?
This is beach landing.
Yeah, so it is a bit odd that a county that is known for fishing and its beaches is making less from landing fees than veterinary services.
Yeah, thank you, Chairman. Let me answer the question on healthcare by saying that even the monies that we are raising currently from health, they are not out of pocket expenditure. They are insurance. They are from payments from SHA. They are payments from insurance. Mostly, actually, 95% is payment by insurance to the facilities. So it's not out of pocket. So even when we get to universal health coverage, like we're doing at the moment, these monies continue to come because people don't pay out of pocket, but they're paid, the insurance pays the facilities. NHIF pays, but SHA pays even more now for facilities because the registration is higher. In terms of fish landing, Mr. Chairman, you are a fisherman yourself, and you know that it has been very, very difficult to harness a revenue stream like fish landing because people have been landing over the years for free. So these are streams that we are introducing, and we are working day and night with our beach management units to try and get them to help us to get these fish landing fees. So fish cess and fish landing are streams that have been nearly non-existent, but they are streams that we are harnessing slowly. But you know that with the protests that we had, it has been very, very difficult to introduce, taxes that did not exist well, because people are very, very jittery about paying new monies. But we are discussing constantly. Even when you look at the fish cess, it is some of the things that were very, very low, but we are growing them, and we are growing them slowly. But we have them as streams because we want to grow them. But you can't grow them alone. You can't be at the beaches and everywhere. You have to grow them in partnership with the beach management units. Those processes sometimes do take time. But Chairman, the point I was making is that overall...
Maybe before you lose it, because as you have said, I'm a fisherman. This committee would not be the one to advocate that you put some tax for boats to land on beaches that existed even before Kenya became Kenya. But your receiver of revenue should have pointed you to a stream called beach service fee, which fetched 10.9 million, where there was a growth from 7 to 10.9. So I think the BMUs underassess. So the BMUs are paying something. Let the message not go out that the Senate is asking for enforcement of landing fees for boats. That will be, there will be an uprising.
Protecting yourself politically or
Chair, first of all,
of interest?
Chair, first of all,
protect indigenous communities.
The governor,
Chairman, is more political protection as opposed to.
Chair, I think the governor has, well, in a way, outed you. Now we know that you're a fisherman. That you have interest to protect when it comes to landing fee. But I think the bigger question, Governor, is, Governor,
Yes.
I think the bigger question is, does it concern you and your government that 70% of your own source revenue comes from a single stream? You know, that should concern anyone. Whether or not that means you introduce fees in landing and whatever you're going to do, it must concern anyone that 70% of an entire county's on-source revenue comes from one revenue stream.
And are we that sick?
That's the problem.
Chair, on health, so that she can combine both. Apart from being concerned, you have said it's not out of pocket, but you are getting. Chair, I think 3 days ago or for last week we were with the ICT committee in Machakos, and they had a pending bill of 500 million from SHA. So what is the success rate? Because as under the arrangement, the wananchi are not supposed to be charged on outpatient. So you have made comparison between the NHIF and SHA. So how can you paint the picture on how this revenue will grow? Because if you are saying it is more significant after the reimburses from NHIF, there will be a great improvement through the social health authority. So can you paint that? And you know, Chair, we saw, and you know, we are judicially noticed that there were some of your facilities that they were being accused that they do not exist, but they receive remittances from SHA, and I think it became a national concern. So maybe put into us that perspective in terms of reimbursement from the social health authority. But on the issue of whether they are sick, I think you should tell us whether is the facilities within Homa Bay serving only Homa Bay residents, or some of your neighbors from Kisumu and Kisii have immigrated, and therefore that is where you are getting more resources.
Okay, Governor.
Thank you, Chairman. Chairman, I think I just wanted to state that the growth in revenue within health is become as a result of tightening a lot of things within the sector, the health sector, and also putting our eyes as a government on the health sector revenues and making sure that we have no leakages there, and that the facilities are facilitated to be able to make their claims and do everything. And we're also registering. We moved our registrations, for example, from 6% to 19% when we were still in NHIF, and now to 49% when we have moved to SHA. So that has been the push. Are we concerned that 70% of our revenue is from health? Yes. We want to diversify our revenue streams. So we have been working, for example, on our land revenues, digitizing of our land records and linking it up to the revenue system. And that also I would like to answer Senator Cherargei, who asked, do we have a digital system? Do we have all our streams onboarded on the digital system? Yes, we have most of our streams onboarded onto the digital system. Land was one of the later ones, but land in the last couple of months, we have also been able to now link up land. So one of the streams that we are putting all our eyes on in this coming financial year, is the land rates revenues, because these are revenues that are there, and if you go after the owners of the land, then they can be able to pay both the arrears that they hold and also the current revenues. That can be able to push. We have pushed a lot our single business permits. As you saw, we have had quite a bit of growth from about 64 to 101 million within one financial year. That's no mean feat. Remembering that Homa Bay is a rural village county, most of the towns are in the rural areas. To try to get SBPs to that extent also took a lot of work, digitization, digital invoicing, so that people are able to pay up for the invoices. I wanted to respond to the question of SHA and the facilities that were said not to have existed, and I think it is very clear that in naming of places, many areas have the same name, and in this case, we had a facility that we are yet to open in Nyandiwa in Kasipul constituency. It is a dispensary. And then we have Nyandiwa Level 4 Hospital, which is in Suba South, which is a facility that has been in existence since the 70s. So apart from the political spin that the issue got, these are two distinct facilities. And recently we received the Health Committee of the National Assembly that came and saw both the facility in Kasipul and the facility in Nyandiwa, and the kind of work that the facilities Nyandiwa has done, even with their FIF, they were very, very impressed at the improvements that have taken place in the real Nyandiwa. But I think there was a political spin to it. I just wanted to make that clear since Senator Cherargei raised it. So the question of are we that sick does not really arise. I think people get sick and go to facilities, but the reason for increase of revenue is very, very deliberate. Very, very deliberate in terms of getting our revenue collection and administration in order. And Chairman, there was a question you asked earlier about how do we project. And I wanted the chairman of the Revenue Board, who's also a long-standing, retired from KRA after serving there for over 30 years, to maybe just make a short response of how do we project our revenue and how did we result in an over-projection that fell short.
Okay, before that interjection, let's hear from the Vice Chair and Senator Sifuna.
Yeah, thank you, Chair. I'm looking at note 12, and I got interested on this revenue stream on conservancy administration, which increased from 1.2 million to 12 million in 2023-2024. And when I look at page 11 of the statements, that conservancy administration, the major increment was as a result of liquor licensing. That is on page 11, up there, which increased from 350,500 to 10.9 million. What was happening before, Governor? Does it mean that there were no licenses or liquor licensing in 2022-2023? So much so that maybe because of a law or just enforcement, we got this increment from 350 to 10.9 million, just for my curiosity, Chair.
Okay. Senator Sifuna.
Yeah, Chair, first of all, Governor, the SHA itself and the Ministry of Health has admitted that there were ghost facilities that were actually receiving payments. So it is not very fair to say that it was just about politics. The government itself has admitted that there were facilities that were getting payments from SHA that do not exist. There was also a list of facilities that was put out, that was banned. And one of the things the ministry explained is that people are registering names of facilities that are so close to each other. That is how they are facilitating the fraud. So the suspicion of Kenyans really was to seek answers, not to say that it was about politics. But I wanted to understand, ordinarily, just for the perspective of people who are not fishermen, like the chair, how much do you charge for these so-called landing fees? Because I want to understand something, Chair. How much is it?
Okay, as the Governor responds, I think we, on the efficiencies or inefficiencies of SHA, the person who should be sitting there is Aden Duale. Unless, Governor, you want to defend Duale's issues, just deal with your issues in Homa Bay. To avoid a very broad conversation that will take us to an area where you do not have subject matter expertise. I think what Senator Sifuna said is a fact, and it is not only happening in Homa Bay, it's happening across the country. I think for SHA, let's go back to how your numbers will look like with the introduction of SHA. I think that's an important thing for us to understand from Homa Bay.
Chair, you made me forget one other thing. In the disclosures themselves, if you look at note number 8, which covers the hospital fees, Governor, you have attributed the bulk of the money from, in terms of the income for the facilities, to payments from insurance and SHA. Now, you have only disclosed level 4 hospitals. Are you saying these are the only hospitals that are paid by SHA in the county? Do you have any other levels of hospitals? And where is the revenue from those?
And I think what we have seen in that kind of disclosure is that you indicate whatever rebates came from NHIF, whatever rebates came from Linda Mama when it used to be there, and whatever was collected from facilities. In this case, you have not provided that breakdown. So it's very difficult to establish the facts around what you had said. Could you deal with the liquor licensing. I know this committee has processed that matter in the past, but just put it on record. But help us understand, now that share has been introduced, because people think that there'll be no payment at the hospital, but then there are certain rebates that are coming. Will those rebates come back to the 800 million that you have been collecting previously? And then we'll allow the chair of your board to tell us about the budgeting process.
Thank you, Chairman. In terms of liquor license, you remember, Chairman, our first meeting in KICC, one of the things we were put to task on is whether we had mapped our facilities and whether we were, ready to push an improvement in that particular revenue stream. And we assured you that by the September of that year, we were going to have fully mapped our liquor facilities, and that was going to result in an improvement. So we mapped all our facilities, and we also mapped them to the system. So we have been able to push increase in liquor licensing by mapping all the liquor facilities, and also through the support by the Revenue Board and the reviews, the monthly reviews of what revenues we are receiving. That is what has resulted in that push. And that push is not just in liquor alone. If you look at the revenue streams, you will see that majority of them, just by leadership, monitoring, and efficient revenue management system and digitization, you're able to see much more revenues. Chair, we are not where we want to be in terms of revenue. We have room for improvement, and a lot of it. And we are daily working on that room for improvement. We are daily improving our revenue, and when we come back for 2024-25, you will see that a lot of the streams, again, we have moved further than where we were. In terms of the question of the levels of facilities that are receiving money, in 2023-24, we were on NHIF mostly, and NHIF was mostly giving money to level 4 facilities, with the exception of Linda Mama, which was being given to facilities, lower level facilities that were charging. Now, with the SHA, now you have the reimbursement of the primary health care fund that is going to lower level facilities, and that's why we are saying lower level facilities are not expecting any money from the public. That is level 2 and 3, because they are getting the primary health care fund directly from SHA. So moving forward, Chairman, we have seen 2024-25, the revenues have actually gone higher. What has happened is out-of-pocket has reduced. And why has out-of-pocket reduced? It has been because of the, and I'm not speaking about for SHA generally. And the reason I also responded to the issue of Nyandiwa was I was responding to the specific Homa Bay question. And even the politics I was referring to was specific Homa Bay politics, not necessarily national politics in that sense. So what we have seen in 2024-25 is an increase. Why? Because and a reduction of out-of-pocket expenditure, but an increase in the amount of reimbursement. This is because SHA has removed the waiting period. The 2 months that you had to wait, the 60 days that you had to wait in NHIF. So if I arrive at a facility and I need to, spend 10,000, but my SHA for the whole year is 6,000, I will pay SHA for 6,000 and then I will receive treatment. So this has seen more people paying in the SHA, and therefore the amount of money that the hospitals are receiving in reimbursement has grown. And the amount of money people are spending on out-of-pocket has reduced. Not for any reason, just because people can pay immediately and get services. The viability of that, or the question of its sustainability and so on, I think that's what you said is a different question, and is a question to be answered by a different person.
There's a capitation. Is it 9,000 on average? It is
900 shillings.
So what does that mean? Is that what reverts back to the facility?
Yes, that is paid to the facility on the basis.
Per visit or annually?
No, is it per quarter? It's per person annually. It's per person annually.
Annually?
Yeah.
So is that equivalent to the reimbursement that you're talking about?
Primary healthcare fund, yes, for the primary healthcare.
So 900 per person annually means that you need 1 million people to make the 900 million that you're making now.
A lot of the 900 million is based on SHIF. It's the insurance part where you conduct a surgery and one surgery will be 70,000, 100,000, even 200,000 sometimes. So a lot of that is in the category of the insurance, not of the primary healthcare fund.
Okay.
That is the level 4 and above.
Senator Wambua?
Chair, no, if this was answered when I was out, then it's okay. I'll get it from the Secretariat. But I'm just wondering, Chair, out of the disclosure, from the disclosure, the entire amount of money that is declared from the health sector as a source of revenue for the county, the entire amount comes from level 4. Is it to say then nothing was received from any other health sector facility? The entire amount to the cent comes from level 4.
It's a good question. It was asked by Senator Sifuna. I think the governor has addressed it. That was Linda Mama from lower facilities. But what the governor has not accepted is that they ought to have broken this down. Receiver of revenue. Receiver of revenue, as a member of the institute, you know what the template requires. You ought to break this down so that we are able to see the components. What comes from out of pocket, what comes from the other insurance funds.
Chair, thanks for bringing that up, because I personally don't believe that people of Homa Bay are not paying out of pocket. Our experience here in Nairobi is totally different. Maybe we need to benchmark. But because there is a ground person here, Chair, allow me to hear from the MCA there. If the Sergeant at Arms can give him the mic, I want to know his experience with his people there in his village. He can tell us his ward, whether really people are not paying out of pocket in Homa Bay. Because here in Nairobi, we are still having cases of people going to the facilities and being asked to pay money out of pocket, and it's not a small number. Honorable
Senator Sifuna, you'll allow me to give the directions.
That's why I asked you,
but we'll be careful not to mix what SHA ought to deliver globally versus the responsibility of Homa Bay County. Because I hear you, I feel you. You want to pick a sample, and we have seen there are issues around SHA. There are issues around SHA. And but it is not for this governor to defend SHA, unless you became the government spokesperson.
No, Chair, you know, when I was speaking, you were a bit distracted. You have framed it for us that we needed a breakdown, yes, to see what really is the situation. Because when the county claims that the bulk of this money is actually reimbursements from SHA, and we in our counties are having challenges, we have to interrogate. Maybe there's something we are doing wrong, or there's something that we can learn from Homa Bay.
Was there SHA in this financial year, or this was NHIF?
This was NHIF because SHA started in October, which would now became the financial year 2024-2025.
Correct.
So what we're discussing now is NHIF.
So this is NHIF. So and maybe the question is the NHIF outstanding reimbursements, whether they were received in full. Because I think that's a national problem for this particular financial year.
No, Homa Bay is owed over 100 million in NHIF claims that were not fully given to us.
So ideally, this should have been at least 941 million, if the 100 million had come.
If the 100 million had come in, yes.
Okay, so members, I'm not defensive. I'm just drawing the line that these are numbers relating to NHIF, and SHA will be in this current financial year.
Yeah, there was a discussion that happened prior to this meeting beginning, where we were suggesting that maybe we should let the vice chair chair today's meeting. I am increasingly getting convinced that you need to move to the next chair, because this is your home county and you might have biases that you might not even be aware of yourself. Because we want to learn. We want to learn from what Homa Bay is doing. The rosy picture that has been painted for us really doesn't make any sense, because we have different experiences in our counties. So when I request the MCA, he's here. Let him tell us his village, the one he represents, is what we are being told the situation that is obtaining on the ground.
That is in order.
And
for the record, my vice chair is also the vice chair of ODM, so that is also not very useful.
Can I chair?
But Chair, I wanted to, Chair.
Okay, order. Let's get back to the issues.
I wanted to be very clear that a big portion of the money that we are receiving is from insurance. People also pay out of pocket. That is also the situation. People also pay out of pocket. But if you compare it to the percentage that we receive from insurance, the percentage from insurance is way higher than what people are paying out of pocket, particularly in the financial year that we are speaking about, which was 2023-2024. But even now, people still pay out of pocket, but the percentage that is paid out of pocket, and this is not because of that the numbers are few. It is because that what people can afford to pay out of pocket is much less than what the insurance will reimburse. For example, if you have 1,000 people paying 1,000 shillings, and you compare it to just one procedure that is going to bring in 100,000, that is why the amount that is being paid from insurance is higher than the amount that is being paid out of pocket. And that is what we explained. And the amount of money that has been consolidated there should be broken down. Because in our financial report every month, it is broken down as level 4 facilities by name. I don't know if we can get just a sample report that we receive at our revenue roundtable so that the senators can see it. It is the level 4 facilities. It is the other facilities, that is level 2 and 3. They are put under one line because there are many. And then it is public health revenue. And then in that report, there is FIF, and then there is what the insurance is going to pay. There is the money that people are paying from their pocket, and then there is money that is paid over.
So, Governor, to help you, going forward, we must demand on that. We must demand for that disclosure. I think that's the reason why this question is arising, because we are used to seeing that breakdown in other county reports. Do you want the MCA to respond first? Or?
Yes, he will. But I just make a comment on what she just said. You know, that which she says would have been given to us, if we had it, well, there will be no question. But you see, we don't have it. What we have is a disclosure of 841, all coming from level 4. We can only engage with that. We cannot engage with what we don't have.
Agreed. Governor, you get the point that disclosure ought to be there. And if it's available, just circulate it. I think it can help to allay some of the fears that we have.
Chairman, we can share a sample of 1 month report as we receive it. We can send it to George.
Send it to George. He can circulate to the members.
The facilities are listed. Then the level 3 facilities lower level facilities are listed. Then the public health revenue is listed. And then it is broken down, and it is from all facilities.
Okay. The Honorable Wanga, don't make a speech. Just deal with the question raised by Senator Sifuna, even though the governor seems to have touched on it. The question was whether Senator Sifuna just frame it precisely, or Wanga is a politician. He might start singing and making a speech.
It's a yes or no. Are your people being asked to pay anything when they go to hospitals? It's that simple.
Thank you, Honorable Chair. Because I've been given a conditional question, and you want me to say yes or no, the answer is yes.
Thank you.
Yeah. And I think the governor, you alluded to it. Yes. So some of the things we are hearing in the political platform might not be factual. When you're told that when hospitali level 1 up to level 4 na usilipe chochote, but kwa ground things could be different. But since this system started in October, I think it is in this forthcoming financial year that we'll be able to get a better view on it. Now, we had said that the chair of the board was to help us to understand the budgeting process, but I want us to deal with a very specific issue on the system first, and then I'll ask the chair to speak after that.
Chair, I have queued for some time.
Oh, sorry, Senator Cherardi.
I think you should not.
Because the system question, you're the one who asked.
Yes.
That's why I wanted to
You are
respond.
doing very well. You should not be intimidated since you are presiding over your county. But just avoid a few biases here and there. Chair, I just want to note number 11, hire of county assets. Governor, the hire of stadium, park and open spaces, you in 2023-2024, and I want to assume you came into power towards the end of September 2022-2023 after being sworn in. You raised 1,723,726, but in the previous financial year, you did not raise anything. What is the reason? That is page number 10. Because I think there is a park called Senator Moses Kajwang. What is the park in Homa Bay? It's called Weno or Werwa. What was the name? Do you have a park? The MCA, Waka.
No, I think put the question to the governor.
No, apart from governor, when was Raila Odinga Stadium complete and become being used by the public? And then number 2, how many park do you have, as in wildlife park or any other? And these open spaces, what do you mean by open spaces? Does it include the what do we call, the auditorium where people are watching Chan matches? Because in the previous year you collected 0, but in the following year you collected 1.7 million. It is your financials. So what is the challenge?
Dr. Lelegwe, Senator.
Chair, on the same questions on performance, I've noted at note 11, not note 11, but under notes 11 of financial statement says agricultural produce road fee has declined from 24 million to 12 million in 2023-2024 financial year. And fairly, when I look at all your revenue streams, this is clearly an outlier, decreasing your revenue at CES.
Under CES on page 8, that's note 1.
Yes. 8. Page 8 at the top there, and note 1. There's a decline by 50%. And when you look at your other revenue streams, most of them has registered positive growth. What might be the reason why at 2023-2024, there was a 50% decline on the agricultural produce road fees?
Governor, let's deal with these issues very quickly so that we move to the other issues.
Thank you, Chair. Chair, in terms of the stadia, and I think Chair Argei has left, but I'll just
respond for the record.
The Raila Odinga Stadium was opened in July 2023, 1st July 2023, which means that the year 2022-23, it was not in operation. And when we opened it, then we got some teams that were now playing, like Shabana, that gave us the revenue that we raised from the stadium. The other open spaces are like the Governor's Park, and now we have an arboretum and also the amphitheater at the lakefront. We will be able to collect some revenues there for weddings and other things, just activities and events, but not for individual persons using the facilities. In terms of the agricultural produce road fee, a lot of the...
The question by Charage was in the 2022-2023, there is zero collection.
Can you see that? That is note number 11, page 10 on your ROR.
But there were other stadiums.
There was no stadium. The stadium was not complete.
There was no park, there was nothing.
There was no park, animal park, you don't have?
No, animal is different, Chair, Senator Cherage. The Ruma National Park is the game park that we have, but we do not receive any revenues from it because it's a national park, not a game reserve. So the revenues go directly to Kenya Wildlife Service.
So there was no stadium, there was no park, there was no open spaces.
That is how much work we have done in the time we have been in office.
Okay, Governor, let's proceed a bit faster. The agricultural produce road fee.
Here, Ndiwa Sukari, which is the main producer of CES, was closed for a while for repairs, and therefore we lost quite a bit of sales in between. And we also had Kibos that was taking sugarcane from Homa Bay to Kisumu, and they also left during that time. So that is the reason that we had the decline in the agricultural monies. Thank you.
Honorable members, I want to request that we look at the systems environment, wrap this up, and then go to the issues in the main executive report. Auditor General, you had an observation on systems environment, and I think you had indicated that there's something that has not been resolved. Very quickly, can you read your finding? As the Auditor General takes us to anomalies in the revenue collection and management system, the issues raised and evaluation role, we'll take note of the responses. This is a matter that should be kept in view because we have looked at the detailed response. So it's something that the auditor will report on in the subsequent audit. But let's deal with anomalies in the revenue collection and management system.
Yeah, thank you, Chair. Anomalies in the revenue collection and the management system. The county government of Homa Bay procured a craft biller system for revenue collection and management from the local vendor through a contract signed on 26th May 2023. However, audit of the system conducted in October 2024 revealed the following anomalies. 1. Error handling had not been hardened. Overly informative errors messages were revealed to users. An attempt to generate receipts returned on error messages with SQL code and revealed that the details of the database and the database management system used by the system. The information revealed that makes the systems an indication that the system vulnerability to attack malicious users and hackers.
Could I guide that you go straight to paragraph 7 because that is where the outstanding matter is.
Yeah, thank you, Chair, for guidance. Paragraph 7, that's page 6 of the financial statements. A review of the contract between the county government of Homa Bay and the vendor revealed that the contract did not specify the contract period and did not provide for the payments of 5% commission on revenue collected, which is paid to the contractor every month. In addition, the contract price was Kenya shilling 28,289,179, including the VAT, with the payment structured in 3 phases: 30% upon submission of the draft report, 40% upon submission of the unacceptable draft report, and 30% upon submission and approval of the final report. Although no reports were provided for audit verification on the phases of the development of the project, the vendor sent a letter reminding the county government to pay an outstanding invoices, warning that the delay could lead to a service disruption as they will shut down the systems on April 12, 2024. Yeah, in the circumstances, the security, integrity, reliability of the revenue collection and the management system and the value for money of the payments made to the vendor could not be confirmed.
Okay, Governor, your response, there are 7 paragraphs there, which we had looked at your response, but if you could narrow down on the paragraph where you are responding to 7, the issue of the 5% commission on revenue collected, which was not supported by the contract. I think that's the outstanding issue in that entire audit finding.
Thank you, Chairman. The management would like to state that the contract of automation of revenue collection and management system provides for payment of commission of 5% of revenue collected as indicated in the Appendix C of the contract. The addendum to the contract provides for a contract duration of 5 years that is renewable, subject to performance review, as set out in the service level agreement. The Appendix 6J, contract on automation of revenue collection and management system, and Appendix 6K, addendum to the contract.
I'm not sure if I'm following where the governor is reading.
Page 9 of 10.
Response, this one.
Page 9 of 10.
Page 9, yes.
Yeah, number 7.
The appendices are the red one. The red one. think it's here.
The annexure.
7 what? Appendix.
So, Chairman, the annexures are 6J and 6K.
So 6J has the contract on automation of revenue collection and management system and addendum to contract agreement. When was the addendum signed, Governor?
I want to ask the attorney to please respond to that.
Thank you very much, Chair. The addendum is one that appears at 6K, and that was done on the 3rd of July, 2023. Should be the last document on the bigger bundle, file 1 out of 1, appendix 1 to 6K. Chair, is the last document.
If this was available as at 3rd of July 2023, why was it not provided to the Auditor General? Because this is an observation that was in the management letter, was in the draft certificate, and was in the final certificate. Why should this Senate believe that this addendum was not backdated or initiated just to close an audit finding? Governor?
Chairman, the 5% charge is on the contract.
Which page?
The last page of the contract. It's highlighted there.
In the addendum or
No.
in the main contract?
In the main contract,
It is 6K.
which is 6J.
6J.
The last pages are ineligible. You can't
But
read them.
I think there's a section that is highlighted, Chair.
Yeah, it is.
You know, Governor, this would be very simple. The auditor raised this and it found its way all the way to the Senate. Where were these contracts when the auditor was asking these questions? Because he says you are paying 5% to a system vendor, but that is not captured anywhere in the contract. And if it was available, I believe that your receiver of revenue would have just furnished the OAG with this information.
And
the risk we run is now processing information that could be doctored for all that we know.
Chair, you know the county attorney is a person that I know personally and have a lot of respect for. I do not doubt his ability as a lawyer. In fact, for full disclosure, he has represented the party that
Before he was
I ran
or as the
before he
government?
joined the county government of. So I am sure he knows that there are terms that go to the root of a contract, and there would be no excuse for those terms to be left out of the main contract and then subsumed in an addendum. That doesn't make sense to me. Governor, you have said there's a reference to the 5% in the main contract. I'm still struggling. I don't know if my colleagues have
the documents are likely unclear.
Could you look at the last page of the contract, where there is a table?
There's a long table that goes all the way to licenses and permits, disputes.
The very last page, Chairman.
We are there.
I don't know whether members you have a better copy, but this is a version I have.
Chair, that is why I wanted to move that this document be struck out, because it's not readable.
They are not legible.
They are not legible. And Chair, from what we know from Oba Bay, it doesn't come out very well, Chair, because nothing is readable, and the county attorney is here. If we cannot read, Governor, how can we assist in interrogating? How are we supposed to read this? Maybe Sifuna can read if he has a better eye.
Chair, can I just guide?
Yes.
If you go to the addendum to contract, and you see, because we are all grown-ups here, we can agree when mistakes have been made and corrected. If you go to the addendum, which is 6K, Honorable Chair, 6K, the addendum to contract agreement has recitals. Those recitals, I believe, are laying a historical foundation for the addendum. And it acknowledges that at the time of execution of the contract agreement, the parties were yet to agree on the contract period. This is 6K.
The second last
page
whereas.
2 on 1, 2, 3, 4 paragraph that appears at number 5 there. Paragraph 5. Not the ones, the whereas, the recitals. Yeah. It says, at the time of execution of the contract agreement, the parties were yet to agree on the contract period and therefore did not provide, therefore, in the special conditions of contract.
Yes.
You are acknowledging that such a fundamental issue as the time of, or the contract duration was not agreed upon. And then you go to say that this addendum is necessitating the provisions that follow there, including the contract period and the other terms there. So you can say it was an oversight in the initial contract, or it had not been agreed as your document itself is saying.
Chair, the point I was making, Chair, was that the 5% commission was part of the original contract. What was not contained, what is contained in the addendum is the period of the contract.
But Governor, we can't see it.
Okay.
Chairman, can I be allowed to provide this clear copy of the contract?
You see, the challenge is this, Governor.
We are not
this auditor was in Homa Bay.
Yes.
And asked that question and captured it in the management letter and captured it in the draft certificate. It was not responded to. What is a justification that today in Nairobi it is being responded to and yet it wasn't done during that audit period? And I think that's why part of our recommendation was administrative action on the officers who failed to provide the documentation on time in the event that the documentation existed. Was there any administrative action taken?
Chair, and in addition, to be fair to us as your members, we are not reading anything. So even if the governor refers until cows come home on the aspects of the contract, we can't read. And a number of us are legal experts, Chair, and we really wanted to get into the substratum of the issue. So how will we assist the Chair to be fair?
Yeah, Chair, finally,
yes.
For the benefit of the people of Homa Bay, I think the most critical thing is the cost that the people of Homa Bay are incurring. Governor, I cannot believe personally that such an important matter would not be contained in the document itself in a more prominent manner. Because anything, even if you are buying mandazi, the first thing you ask is how much is this thing? And the contract has to provide for it. So it is unbelievable. And as I said, I have a lot of respect for your county attorney. If mistakes were made, we can just own up and say there were mistakes.
But Chair, this is more than a mistake, eh? Because are you saying, through the Chair, Governor, are you saying that the 5% is provided for on the last page of?
Yes, the 5% is provided for on this contract where it says summary of costs. And Chairman, if you allow me, I would like to table a clear, I would like to apologize for the document not being clear, and I would like to table, Chairman, if you agree for your purpose, a clearer version of the contract document.
It's
9 copies, so that it's is enough.
Sometimes you are constrained to take new evidence at this point, yes. But because you are quasi-judicial, maybe first table it to the clerk and then we'll take a view. But you see the point.
Does it mean we don't interrogate that aspect? Because
no, we definitely would, because in line with Senator Sifuna's query, the first page of the contract agreement talks about the 28 million.
Correct.
So the curiosity is why the 5% was captured in an appendix on the last page of the contract. You see, that's a reason for curiosity. Yes. That this could have been an afterthought, or this could have been an insertion to an original contract that wasn't there. And that is why the Auditor General asked that question, and it was not answered when the Auditor General was in Homa Bay.
Chairman, I want to say that, and this is under oath in the House here, that if the figure had not been part of the main contract, it would not be in anybody's interest to insert it and then say it is part of the original contract. So it was there, Chairman, but the reason it wasn't provided, I want to agree with the committee that the document should have been provided to the auditors in full, including the addendum, so that we did not have to raise this issue here. And Chairman, I want to assure you that whoever did not provide the document, we will take administrative action against them.
Governor, unfortunately, we have taken your copy of the document.
Yes.
And the beauty with this agreement is that it is signed on every page. Governor, if you look at the signatures on the previous page and the ones on this last page that you're now providing, they don't look the same. They have been signed by different people, and yet the people who have signed from the beginning are consistent. What is the explanation there? Just look at the previous page, Appendix B. The document, the page you are looking at is the Appendix C, Summary of Costs. Just flip one page back to Appendix B and look at the signatures down there.
Go back as many pages as you want.
There is one distinct signature on Appendix C that is not on the other pages.
Yes.
This one that looks like a millipede.
I can see you're still traumatized from the BBI days, yes. But
no, that was Okoa Kenya.
Okoa Kenya.
Yeah. Governor, would you quickly respond to that? I think it's a valid observation.
I want to ask the attorney to respond to that.
Thank you very much, Chair. Chair, I just want to make reference to the document that is annexed at 6J, which is the contract on automation of revenue collection and management system. So, Chair, if you go to that document on page 2, you will see what constitutes the contract. And from the word go, you will see that at part C, whereas the amount of the contract is stated there at part C. But it goes ahead at paragraph 1, now therefore, that the following documents attached here shall be deemed to form an integral part of this contract. So it lists them, and it goes to number C, the appendices. Now on the appendices, number 1 is terms of reference, number 2 is the key experts, and appendix C is reimbursable cost estimates. So appendix A, B, and C constitute part of this contract. Now, what Her Excellency is referring to, and where there is a 5%, is appendix C. Now, if you go to the second last page of that document, it lists now the appendices. Number B is the key experts, then the last page is the breakdown of contract prices. Now, it lists the amount of money, and at paragraph 3, maybe it is just because it's not clear, it says the transaction fee, and on the right side of the column, it says 5%. So these appendices were part of the original contract. So that there is no confusion, Chair, the last document, the one that is dated 3rd of July, the appendix, the addendum to contract, the addendum to contract is specific to the term. Chair, if you look at
we are with you on the same page. We are with you on that.
Yes.
The observation is Appendix C,
yes,
and Appendix B has got different signatories. Maybe that's what you need to address yourself to.
Can the signatory himself address himself to that, who's the Chief Officer Finance?
And it would also have been very useful for Appendix D and E to be availed, so that we know whether they've also been signed, because they form part of the contract, as Attorney Orego has said.
I think just before the expert, what was the term?
The signatory.
The signatory.
Receiver of revenue.
Governor, just allow me to help you. This is a legal question, and I think you should allow your county attorney to explain to the Senate how it is possible, because all these documents he has run through are one contract. It is not possible for sections of the contract to be signed by Wambua, then Cherargei signs C, and then Sifuna signs B. I want him to first say that himself as a professional, whether it is possible for individuals to pop in and out of contracts when they have not been part of the entire thing.
Chairman, I wanted that to be addressed by the signatory to the contract, if you allow me.
Very well.
So that if there's any legal question, the attorney, there's an explanation that he has given me, but I want him to just give it to the Senate.
Okay, please.
Thank you, Chair and the committee. My name is Alphonse Vera, Chief Officer Finance and the Receiver of Revenue. That is my signature, and I gave the one which is...
on the new document or the new one?
The new signature.
The one that Senator described. It's not new. If we start from the first page of the contract...
No. Where is it on Appendix B?
I'll refer to where it is.
Where is it on Appendix B?
Appendix, all the appendices, I have done an initial, I've initialized all the appendices, but because that page contains the figure of 28 million, I gave my full signature, which I have also done up. If you go to the fourth page of the same contract, you'll see the same full signature signed on the page where all the officials of the county have signed. That is the fourth page of that contract.
So you put your full signature only where money...
Where there is money in the appendices, I put my full signature, the same signature that is in page 4.
What about page 1 where 28 million is mentioned?
Sorry?
The first page of the contract agreement, where there is 21 million mentioned. 28.289 million.
Chair, that table has a breakdown of all the costs. That is why I put in my full signature.
Honorable members, does that make sense?
Can I ask, the other pages you're saying you also initialed?
No, all the other pages have initials on the left-hand side.
So these initials, which one, KB, is yours?
No, the one that is a cycle.
Okay. So I still see it on that last page.
Yes,
so you're saying you initialed and signed in
yes,
full.
I initialed and signed my full signature. And if you go to page 4, where the officials of the county have signed, the Director of Procurement, Chief Officer, and the others have also signed that page with the same signature. So it was there at the signing of this document. I can confirm that.
So what's the explanation again? Why are you signing the final page and you're not signing on the other page? What's the explanation?
I've signed the page where I'm supposed to formally sign, that is page 4, and then I have singled out this specific page because it has got a breakdown of costs.
So, receiver of revenue, when you saw this query from the Auditor General, and you are saying that you put your full signature on it, why didn't you address it and close it at that point in time? Why has it come to the Senate? Why are we discussing it? If that addendum was available, and it was your signature, and it is your report, you are the receiver of revenue.
Chair, to answer to that, the addendum, I think we are looking at the main contract, and because...
Sorry, the appendix. Let's refer to the appendix.
Yeah, the appendix of the main contract, it's not advisable to have a claim and a counterclaim, but that figure...
Receiver of revenue.
Yeah.
You say that you signed this appendix C.
Yes, I did.
That has a 5%.
Yes, I did.
Did you see this observation by the Auditor General in the draft certificate?
Yes, Chair, I saw.
Why didn't you address it at that point in time?
We did address and responded to it, Chair.
So how did it end up in the Senate and in the public domain? Because the auditor was not satisfied. Perhaps for the reasons that the committee is presenting now. So, honourable members,
Chair, perhaps you need to perhaps you need to provide context for why members grow suspicious of such presentation before the Senate. There has been a case of a county entity that came here with receipts. You remember, Chair?
Yes.
And from just a casual observation, you could tell that these documents had just been manufactured to answer or respond to the audit query. And that's why the chair is saying these auditors, because again, I repeat, I'm also audited, Governor, you know, I'm also an accounting officer. There is no way the auditor can ask the Honorable Kawino to produce a document, then he refuses to produce, and then he shows up with the document at the Senate. So, Auditor General, do you go through the same process you go with me? At the party of mine is more robust because we sit down with you, you do management letters, there are exit meetings. Why can't you have these issues cleared during the point of audit?
Yeah, thank you, Mr. Chair. Of course, the audit process is the same from the entry meeting, exit meeting, raising an ML, raising a draft. And again, maybe the issue is if there are contracts that have been provided, and that's why the audit has really picked the issue, if there are annexes supporting that contract, and probably you have just provided the face value of the contract, this some information is really missing. So at the point of maybe the ML issuance or even at the exit meeting, if there are annexes or maybe even the addendum that post the changes of some of the contract terms, then at that point could be provided for us to address the issue.
Senator Cherargei, and then ROR, you'll tell us this 5%, let's put it in context. How much money is it annually so that we know what we are dealing with? Senator Cherargei.
Yeah, I can see one of the residents of Homa Bay is calling me. I don't know why. Chair, maybe I've known the mischief. I've known the mischief why the governor has provided not readable contract, because when you look at page 103, Governor, this is in J, this is 6J. I think page of 3 I have struggled, Chair. Governor, I need clarity. And of course, you have said you will take administrative action for somebody who prepared this documentation. Why were you paying in pounds professional liability insurance with a minimum coverage of any occurrence which is £500,000 on and any period of insurance to £1 million? And then in number 38.1, the contract price was 28,289,179 inclusive of the VAT. Why were you using two currencies? One, you are using pounds, unless maybe the governor will tell us whether this company is local, or is it a UK-based company, or is it domain is here in Kenya? Because if the contract sum was 28 million, then professional liability insurance with a minimum coverage of that is between 500,000 to 1 million pounds. Why was the inconsistency? What was the wisdom in the drafting of, and we have had the stories of the signatory, which does not look believable, Chair. What was this inconsistency? And by the way, Governor, can you provide us who are the people who signed, apart from one signatory, who signed and negotiated this contract? Because there is a process of contract, and why the difference between pounds and shillings? This is very unique, Chair.
Governor? And this is a problem of not providing documentation at the time of audit, because once it comes to the Senate, it's in the public domain, and we have all the rights to ask questions.
Chairman, I think we have, on the issue of the signature, I think it has been answered to the best of our knowledge.
Not necessarily to the satisfaction of the committee.
To the best of our knowledge by the person who signed the contract. And Chairman, for the contract to be executed, you have to pay the service provider this amount. And Alphonse will be responding to what kind of amount it is. And even just looking at it practically, for the service provider to sign a contract without us, indicating what kind of percentage we will be paying them, also, would not make sense even to the provider themselves. And that is why I want to, submit that this part of the amount or the percentage of money was part of that original contract. And I do this, Chairman, in good faith and under oath. I want to ask the attorney to respond to the figures that have been provided, the provisional liability figures that have been provided in pounds.
Thank you very much, Chair. In respect of paragraph 24.1, the insurance coverage against the risk shall be as follows. So it's the professional liability insurance with a minimum coverage of any occurrence at $500,000 and any one period of insurance at $1 million.
In dollars or pounds?
It's actually in dollars.
Is it dollars?
It's actually $1 million.
And we are struggling, Wakili, with all what you have brought before us. They are not legible. And we are not superhuman.
The figure is $500,000, and in one period a maximum of $1 million. Those are the figures. These are the terms. Ordinarily, these are provided for by insurance companies. So that in terms of exposure, that is what they usually provide for.
I agree with the principle, but,
Yes.
but what was the wisdom in having in different? You know, you are bringing us to IPP. You remember the story of independent power producers, and you are in parliament, where Kenyans were questioning, why are you buying power through IPP agreements in dollars? So that is my only concern. And she was the chair of finance and in the last session.
Because in that case, AG, what
Yes.
you have done, you have really fully taken care of the insurer.
Yes.
But you have exposed.
And the changes in terms of currency will keep changing every minute, even if you go to NSE.
And I should believe that if you are worried about the currency, this actually protects the county more, because the dollar ideally will be more stable than the shilling, looking at past rates. So in terms of cover,
the shilling has been stable at 120, 130 for the last.
yes, but the point is noted. When we're doing our next set, I think we'll put in shillings. But the problem usually with these documents is that sometimes you find that they're standard documents that are used from PPOA. But the point, I think, is well taken. But the intention was to prevent and protect the county government
Were
from
you
losses.
there when this contract was negotiated and executed?
No, I did the addendum. I did the addendum.
Then there is an inconsistency that governor said, so you are not there. There was another county attorney.
Yes, at the time I wasn't there.
But if you are not there, why did you say in addendum that that Senator Sifuna had pointed out, your indulgence chair?
Yes.
And whereas at the time of execution of the contract agreement, the parties were yet to agree on the contract period and therefore did not provide therefore in special conditions. So had you been aware of the original contract?
Actually, through the chair, if you look at the contract at 14.1, it provides that the contract period will be agreed upon. Now, when the contract was signed at the time, that was not done. So you will see that in the addendum, that now that is executed by me because now I had joined in July of 2023. It now provides for what should have been put in 14.1 under the special conditions. So we are provided now for the period of the contract. That is actually the basis of the addendum.
In 24.1, it says
14.1.
I'm talking about 24.1 on the insurance cover.
Yes.
It says at any one period of insurance. So what did that mean?
Yes, so because
2028?
Yeah, no, because this is a multiple year contract every financial year. So because you take a cover each and every year for the that's what it refers to.
So why did you indicate that it's 12 months or you use the financial year?
It's one financial year. Every insurance.
But you have said one period, and the interpretation of one period and one financial year are 2 worlds apart to kill it.
It's one insurance period.
Can you take an oath? Because now, Chair, the Wakil is trying to be clever by half.
I think we'll take a view. I think there's some inconsistencies that as a committee we must apply our minds to. And this is a self-inflicted problem, Governor, because you didn't need to come with these contracts to the Senate if you would have provided them to the Auditor General. And it is inviting more questions, which puts a lot of doubt on the contractual agreement here. To allow Senator Cherargei to close, and then we quantify what this 5% is. I mean, how much has it been on an annual basis?
In this arrangement of automation of on-source revenue in Moma Bay, I'm not comfortable. it looks like the people of Homa Bay have been ripped off. So I request that we step down this question, we assess as the committee to see if there was value in terms of this use of this system and this contract. Because we need even to invite the company. Because in the observation of the OAG, there was supposed to be interruption of services at some point. So we need to know what was, we have seen the agreement, not legible, but we need to study this contract. Because to me, there is a lot of inconsistency between the original contract and the addendum. And the fact that there is difference in currency, there is the issue of agency fees, or is it commission fee of 5%? Can we look as a committee internally on the inconsistencies of this contract to ensure there is a benefit to the people of
I think you are giving a way forward, which we can give once we have heard how much is this 5% that you've been paying? How much is it? Because we don't have a picture on how many streams run through this system and how much you are collecting annually through this system, so that we contextualize the size of the problem. Did you get my question? How much are you collecting through the system annually?
Yes, Chair. We have, I can talk about an average of about 2 million.
Only 2 million goes through the system?
No, I'm saying that this 5%, because we collect...
No, start with what you collect.
We collect between, depending on the month, we collect between 16 million to 34 million.
So annually?
That is off medical income. FIF, the bigger portion of our income is not part of what is considered, because it is not being collected using this system. So we are other income outside the public health and medical service income, which ranges between 16 million to around 36 or so million. And in a month where we are collecting the SBP, that is a single business permit, it can go up to 16 million. So averagely it's around 2 million over the regular period of collection. That is per month.
CEO, you know you are giving too much information, which is going to land you into problems.
Chairman,
just tell us, in a year,
Chairman,
how much passes through the system?
Yeah.
Is this 5% monthly or this is annual?
It's monthly.
It is monthly.
Chairman, it is 5% on the monies that we raise. So what CEO needs to do is just to work out how much money passes through the system,
yes,
and what is 5% of it.
So
I think that is what he needs to, just give him a few minutes, Chairman, your indulgence, to work out that amount, and then just give the figure. But Chairman, I wanted to say from what Senator Cherargei said, that to say that the people of Homa Bay are being ripped off from this system, I feel, Chairman, is inflammatory in the sense that nothing on the issues we are discussing have spoken to ripping off of the people of Homa Bay.
No, I think, Governor, that was his opinion. As a chair, I will give the way forward.
Thank you, Chairman.
Yeah, let's just allow him to also hold an opinion.
Chair, the Governor, before Senator...
No, you have stated your opinion. There is no need to...
No, it's not about opinion. It's about facts.
Yes. So you are on record.
Chair, if we wanted an opinion, we could do a literature class. But you know, facts are stubborn. They are provided.
You have made the point. Yes. Allow Senator Wambua to also make his point.
You know, we've been in this committee for a while now, and you know I hardly ever agree with Senator Cherargei on a lot of issues. But on this matter, I think I want to propose, Chair, and I know you're going to give that way forward, we step down this interrogation on this contract. Because, Chair, if you realize, it's like we are carrying out the audit here. We are doing the audit here. They are calculating the figures here. They are taking us through the signatures here. Chair, this should not be happening here. The documents that we have, it's very difficult for us to engage on the basis of the documents that we have. They are hardly legible. So, Chair, I would propose that we step this down and engage on this at a later date thoroughly. As to whether there are reports or not, Cherargei is only accountable to his own statements. Thank you.
Yeah, no, I mean, he has a right to express himself, whether it's facts or opinion. ROR, you have the number, or we can proceed and we come back to this later? Well, if you're struggling, then what we'll do, this is a matter that will then, there are two elements to it. Keeping it in
Chairman,
view.
he has a figure.
Okay, proceed.
For the financial year we are looking at, that is 17,962,251.
That was 23-24 for that financial year.
Yeah.
That's the 5%.
That's the 5%.
Which, if this committee was to reach the conclusion that it was not lawfully levied, then that would be the figure we are citing or referring to the EACC.
That is the calculated figure.
Okay, honorable members, let's. I've had two requests that we stand down this particular matter. We will consult with the Auditor General on this, and perhaps internally, so that we consider which direction we are giving this, because we started with the documents that were not legible. We started with an auditor who had been in the county for several months and was not provided with these documents. So I will agree with Senator Wambua and Senator Cherargei to the extent that we give this matter further consideration. Now, there are a few other issues in the ROR where we will take the written responses. I think a substantive matter was on the valuation role. We have taken note of your response, particularly the legislative changes at the national level that have posed a challenge to county governments. I think it's also a matter that we shall keep in view. I want to, for purposes of time, request that we go to the report on the executive. The Auditor General has already flagged those issues that are still outstanding. And on the report of the executive, we will start with pending accounts payable. Auditor, pending accounts payable.
Yeah, thank you, Chair. Pending accounts payable, note 19.1, and other important disclosure and Annex 3 to the financial statements reflect the pending accounts payable totaling to Kenya shilling 955,548,525 in respect to the accounts payable brought forward through the year 2022-2023. During the year under review, pending bills to the county executive in CAT, pending bills of Kenya shilling 1,098,638,645, bringing a total pending bill for Kenya shilling 2,054,177,170, out of which the management settled an amount of 861.9 million, leaving a balance of 1.1 billion. This is indicative of the county government failure to settle the pending bills as first charge to the budget, contrary to the requirement of the Regulation 41 of the County Public Finance Management Act, County Government Regulation 2015.
Now, as I said earlier, the Senate made certain recommendations, and the recommendation on pending bills was generic across the 47 counties because there was a motion that the House adopted that would guide counties in treatment of pending bills. So you might find that our recommendation was fairly generic because it applied to all the 47 counties. It is a very lengthy recommendation, so we don't need to read it verbatim. Let me just ask the governor to respond on the action taken.
Thank you, Chairman. Homa Bay County has undertaken significant measures to address pending bills and has established an active payment plan in collaboration with the Office of the Controller of Budget, which prioritizes pending bills as a first charge on available resources. The pending bills for financial year 2023-2024 were not fully settled due to limited fiscal space during the period. However, under the payment plan for financial year 24-25, the county has disbursed a total of 620,478,914 between July 2024 and June 2025. The county government remains committed to settling the outstanding balance of 571,788,903 in accordance with the approved payment plan outlined below. First quarter 2025-2026, 38,986,223. Second quarter 25-26, 135,600,200. Third quarter 2025-2026, 147,256,324. And in the fourth quarter, 101,256,300. And in financial year 2026-2027, 148,689,846. We have appendices there. 5A, pending bills. 5B, outstanding bills of 571,788,903. And 5C, pending bills paid of 620,478,914. Thank you, Chair.
Governor, in your appendices, is there any that does an aging analysis of the outstanding bills?
The month and year in which they were incurred is showed on the first column.
Where do we get that? Is that which appendix? So 5B or
5A, the first column. 5B has an aging analysis. 1 to 2 years, 2 to 3 years, and over 3 years. 5C.
So 5A is a payment plan.
That is a list of pending bills.
5A. But the header there is pending bills payment plan.
Yeah.
So it's a payment plan.
It's a payment plan. It's a list and a plan.
Then 5B is what is outstanding after paying what is in 5A.
Yes, 571,788.
Okay. So of this outstanding pending bill list, just want to see the aging. Is there a way of telling the age of whatever remains of the 571 million?
Yes.
Or there's a date of the LPO, LSO contract number.
There is a summary on the first page that shows those that are under 1 year, 1 to 2 years, 2 to 3 years, and over 3 years.
So, in your outstanding pending bills of 571 million, only 1% is over 3 years.
7.8 million.
That's 1%.
Those are the eligible bills, not the ones that are claimed. The ones that are claimed are many, but the ones that were tasked as eligible.
So you have another list of ineligible pending bills.
There is ineligible pending bills, yes, under the report that we received from the task force that we put together. This has been availed to the contractors.
So why are we, if they are ineligible through your processes, why are they still in our books?
They are not in our books now. It is a separate list. I'm just mentioning this because of you mentioned earlier about the pressure and the petitions that you had received. That's why I was mentioning that.
So is the pressure coming from those on the ineligible list or the ones on the eligible list?
Both. Both. There are those who feel strongly that they submitted bills, but they know they have been informed that they are ineligible. So both groups continue to put pressure.
If you as head of a government, using whatever systems, you have gone through this process and said that X is a list of ineligible bills, which other institution can change that position?
The vetting process ended there.
So, because, you know, these things must be brought to a close. If it is ineligible through your processes, and maybe you need to describe what that process was, because you cannot carry ineligible bills and have them hanging in the air for 3-4 years. In this financial year, Auditor General, we have moved to accrual from cash basis, and therefore pending bills will be treated in a different manner. Do we expect the County of Homa Bay to carry the ineligible bills in the balance sheet?
Maybe Chair, this requires some guidance, because if they have confirmed and it has been indicated that it's ineligible, and probably even the contractor has not provided the required, there is a process they have gone through in terms of even confirming the work they have done, or maybe even the documentations. So that brings the issue of the separations, because how do you bring them as payable if probably the documentation itself is also missing? Or maybe the vetting process has confirmed that the work has not also been done, because it's a process that has been done by the management.
Yeah, so
Chair, can I say something about these pending bills before Senator Wambu? I thought this matter had been canvassed at Kitale High Court, that the people who should only verify, and I wish the governor was listening, and it's good the county attorney is here. I don't know whether, Governor, you are aware when Governor of Trans Nzoia tried to form a verification pending bills committee, the courts ruled that in Kitale High Court that it is only the OAG was the verification of pending bills. So my question would be, during that time when you formed a task force, did you form a task force before that decision came into play? And now that you have indicated the eligible and illegible pending bills, how many in that task force report, if you could be kind enough to provide us a copy, and tell this committee which are legible pending bills and eligible pending bills, and whether the OAG was involved in the task force report in terms of verification of the pending bills. And I would like to know whether your county attorney did advise you on the implications of that decision. Because I think the OAG, Muriuki, you still maintain that you are the only constitutional recognized body that you can only verify. So on this account payables, through the chair, on these accountable payables on pending bills, were you capturing what you had from the raw data that were provided through financial statements that the entity provided, or what was the essence? That because the governor now is saying there is a report they did and they were paying as per that report, yet in the OAG report, where is the nexus? Maybe the OAG can go first and then the governor through the chair.
Okay. Yeah, so let's understand the process and then confirm whether it's in line with the court ruling in Kitale. So, but that should be described by the governor, isn't it?
Whether the OAG participated in the entire process.
In the verification.
Yeah.
OAG?
Sure, we didn't participate through the vetting of those pending bills, especially for the contractors.
Okay. Governor, what was the process that you instituted?
Yeah. Chair, we, as many counties did, we did institute a task force, which I appointed and gazetted, that made a public call in the newspapers for anybody who had pending bills to submit. The committee was made out of senior, auditors and other very senior professionals. All the contractors submitted their bills, the ones that, and you were told to submit bills and documents, which they did. The audit committee then looked through the documents. They also took the documents from the county that were there. They looked through all of them. They went round the projects. If you say you did a road or a toilet or whatever it is, they went round and checked all those projects. And I think they were able to go around to about 85% of the projects. Then they did a report which was made public to the contractors, and then there was an appeal window that was also given for contractors who felt that their contracts were ineligible. This was done together with our internal audit department, and I wanted the attorney to speak to the issue of the case, because I remember when we were back here in the Senate when the issue of the case came up, but we had already concluded our processes by then. But attorney, please intervene on the case and how it affected our
Before
process.
attorney comes on board, so what was the number that was deemed to be ineligible? Before attorney talks to the